Hey, Dr. Derek Nilsson here, the owner of Kaizen Physical Therapy. Today I wanted to answer a question that I got the other day of do I need back surgery or when do I need back surgery? So let's talk about that. Almost always back surgery is unnecessary if you're going into surgery purely for pain. If you're going into back surgery because you want to come out with less pain, time and time again, studies have shown us that that's an unlikely outcome. You're not a surgical candidate typically. You're a pain candidate. You need somebody to help you with pain. You don't need somebody to go in there and fix something for pain relief, because that usually doesn't work out that way. So if you are going into back surgery purely for pain, please get a second opinion from another surgeon, but also find somebody that looks at how you move from your head down to your ankles and actually lays their hands on you. Because somebody that just does an x-ray or an MRI and diagnoses the problem through that is missing the big picture. Often, because an MRI or an x-ray can't even show pain. You can't see pain. So the person reading the MRI or the x-ray is making an assumption that what they see is the cause of your pain. And if they're not looking at how you move from your head to your ankles, and they're not laying their hands on you to see what spots are tender, what's not moving like it should, then the x-ray and MRI are almost always meaningless. Unless if they find a tumor or cancer or a cyst or something that's causing so much dysfunction that they need to go in there immediately for surgery to remove, because if they don't, there's going to be some sort of long-term damage that there's no turning back from. So again, if you're going into back surgery purely for a pain outcome, you probably are not a back surgical candidate. However, if you're going into surgery because you have a functional problem, let's say, for instance, I had a patient in the other day, he was losing function in his hands, he was losing weakness. And so they went in there and did a spinal fusion, and now he has full function in his hands. That's a surgical candidate. Not a pain solution. Somebody that actually is losing function in their hands or losing function in their legs. They're complaining of muscle weakness, and what's happening typically is the nerve is being pinched or blocked. If there's a severe herniated disc, that can cause it, or spinal stenosis, something like that. But that's a surgical candidate. Somebody going in purely for a pain relief is not typically a surgical candidate. But this brings up a good point, is I have people in here quite often that come to me for sciatica, and they say that they have a herniated disc, which they've been told is the cause, and they've been told that they need a spinal fusion, and that's the next step, but they don't want surgery. Oftentimes this person, it's not even a herniated disc problem, even if you've been diagnosed with a herniated disc. So this is why it's so important to find somebody that looks at how you move from your head to your feet and actually lays their hands on you. Because without looking at how you move, without laying their hands on you to find out where it hurts, if there's a possible referral pain, what else is going on, the MRI, the x-ray is almost meaningless because of this. Science has shown us time and time again, people with absolutely no pain have the same findings on an x-ray and MRI as people with pain. So what does that mean? That means that it's extremely likely that your pain is actually being caused from muscle pain. Even though you have a herniated disc or degenerative disc disease or arthritis, people with no pain have these exact same findings when we take an image of them. And so oftentimes that's not even the problem. That's why it's so important, if you're going into your surgeon, it's so important that they don't just take an x-ray or an MRI, because that's a very limited view. They need to, if they're going to take an x-ray or an MRI, they need to also see how you move from your head to your feet, and they need to lay their hands on you to see exactly what's going on. Because that gives us a lot more information than just an x-ray or an MRI. And in fact, oftentimes you don't even need an x-ray or an MRI. You don't even need one, especially if you have a pain problem. Typically, you don't even need one. You need to find a pain solution. You're not a surgical candidate, and typically you don't even need an x-ray and MRI to tell you what the problem is. You need somebody that looks how you move from your head to your toe and actually lays their hands on you. I hope that helped out. Listen, if you want to learn more, get my free book. You can find it at thepainreliefbook.com. You can download it completely free. I don't even need your email address, no phone number, no name. That's how much I want to help you. You'll learn more about what I just talked about, and there's plenty more in there to help guide you through the healthcare system, as well as start to learn more about your body. Again, you can find that at thepainreliefbook.com. Thanks so much.